Hi, my name is Melina Santos, and this is my head to toe for the spring 2025 Child's Health class with Dr. Buford. This is my patient, and I'm going to quickly scan my room here. I have the walls, my equipment. Here's the ceiling and the floor. Okay, so I'm going to start my head to toe by assessing the skin of the head, the face, the neck, the anterior and posterior chest, and the abdomen. And then I'm going to assess the head size, symmetry, and ensuring midline position. And then I'm going to assess the scalp. I'm going to look at the hair color, texture, distribution, and looking for any infestations, as well as feeling, palpating the scalp for any masses, lesions, tenderness, depressions, or any abnormalities. And then I'm going to palpate the temporal arteries for any tenderness. And then I'm going to be feeling the lymph nodes for any swelling. So the preauricular lymph node, the postauricular lymph node, the tonsillar lymph node, the submandibular lymph nodes, the submental lymph nodes, the anterior cervical lymph node, the posterior cervical lymph node, the occipital lymph nodes, and the supraclavicular lymph nodes. Okay, now I'm going to be moving on to the ears, or actually I'm going to be assessing cranial nerve number 5. The sensation part of cranial nerve number 5, so yes, I'm going to have you close your eyes and then let me know where I'm touching you.
Forehead, left cheek, right cheek, nose, chin. Okay,
and that was cranial nerve number 5, trigeminal. And then the sensory portion, and now we're going to do the motor portion of cranial nerve number 5, trigeminal. So bite down for me, feeling that masseter muscle that's nice and strong. And while we're here, we're going to go ahead and assess the TMJ. So I'm going to have you open and close your mouth for me. Okay, we're assessing for any crepitus, tenderness, or subluxation in the joint. And then I'm going to assess the ears. Or actually, first I'm going to assess cranial nerve number 7. Sorry about that. Facial. So can you raise your eyebrows up for me? Good. Can you puff your cheeks out? Can you smile? Can you give me a frown? And can you pucker your cheeks or your lips? Perfect. Okay, now we're going to assess the ears. We're going to be looking at the ear shape and position, and we're going to palpate for any tenderness or masses of the pinna and the tragus. And then I'm going to take the otoscope and look inside the ears at the auditory canal as well as the tympanic membrane. Okay, good there. Okay, good there. And then we're going to assess the cranial nerve number 8, vestibulocochlear or auditory. So we're going to begin by doing the whisper test. So yes, look forward to me and whisper back what I say to you.
1, 2, 3.
Oh, sorry. Can you close your left ear for me? Okay, now again.
A, B, C.
Okay, perfect. Now the other side.
1, 2, 3.
Okay, perfect. And now we're going to be using this tuning fork to assess for the lateralization with the Weber test. So let me know if you can hear this equally or better in one ear or the other.
Equally.
Okay, and now we're going to be doing the Rand test to assess for air and bone conduction. So let me know when you stop hearing this.
Stop. Stop.
Okay, now the other side.
Stop. Stop.
Okay, so air conduction is greater than bone conduction. And now we're going to be assessing the eyes. I'm going to be looking at I'm going to lift your eyeglasses up for a little. I'm going to be looking at the eyebrows, the eyelashes, and the palpebral fissure. And then we're going to be looking at the sclera and conjunctiva, the color, looking for any lesions or discharge. Okay, good. And now we're going to be assessing cranial nerve number 2, optic. And we're going to be doing that with the Snellen chart. We're going to be assessing for both central and peripheral vision. So I'm going to have you read the lowest number or letters here for me.
LTFPH.
Okay, perfect. Now I'm going to have you cover your left eye. And then tell me how many fingers I'm holding up.
3, 2,
Now the other side.
3, 2.
Okay, perfect. And now we're going to be doing cranial nerve number 3, ocular motor. And I'm going to be looking, doing direct and consensual pupillary reaction to light. So again, look straight at me. Okay, good. Both pupils reacted. Okay, perfect. And now we're going to be doing cranial nerves 3 again, ocular motor 4, trochlear, and 6 abducens. And we're going to be doing that by you following my pen gaze. We're going to do the 6 fields of gaze as well as accommodation and convergence, okay? Okay, perfect. And now we're going to move on to the nose. I'm going to make sure that the nose is midline and straight, and I'm going to assess for nasal patency. So breathe in, and now breathe in again. Did both of those feel equal? Okay. Now we're going to assess the frontal sinuses and the maxillary sinuses. Okay, good. And now we're going to be assessing cranial nerve number 1, olfactory. Can you close your eyes for me? Let me know what you smell.
Fruity, lotion.
Okay, perfect. And now we're going to be moving on to the mouth. We're going to assess with our light here. We're going to assess the lips, the teeth, the buccal mucosa, the tongue, underneath the tongue. Can you lift your tongue up for me? The salivary ducts. Okay, put your tongue down. The palate, open up. The palate, the posterior pharynx, and the tonsils, which is a grade 1. And now we're going to be assessing cranial nerve number 9, glossopharyngeal, and cranial nerve number 10, vagus. So can you stick your tongue out for me and say ah? Okay, good. So the posterior pharynx and the uvula rose with phonation. And now I'm going to have you stick your tongue out. And we're assessing cranial nerve number 12, glossopharyngeal. So his tongue was midline and straight without any fasciculations. So that's good. Now we're going to be moving on to to the throat and the neck. So I'm going to be making sure that the trachea is midline and straight. And then I'm going to palpate for the thyroid gland. And then we're going to palpate both carotid pulses. Perfect. And now we're going to listen for bruits at the carotid pulses. Okay, nothing there. And now we're going to have you flip around and I'm going to assess the posterior chest. So first we're going to assess that there's no signs of respiratory distress. So he's not in the tripod positioning. We're looking for use of accessory muscles, retractions, any cyanosis in the skin, any tachypnea, tripod positioning, any of that. And then we're going to assess for any obvious deformities and symmetry in the back. And then we're going to palpate for equal chest expansion. So take a big breath in and out. Okay, perfect. And now we're going to be doing tactile fremitus. So I'm going to have you say the words 99 all the way down.
99, 99, 99, 99, 99.
Okay, perfect. And now we're going to be percussing in each of the intercostal spaces. Okay, perfect. And I'm going to listen to the posterior lung fields. Okay, big breaths in and out for me. Okay, perfect. And now we're going to be assessing for egophony. So I'm going to have you say the letter E every time I move my stethoscope.
E, 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 E.
Okay, now I'm going to have you say the words 99 for bronchophony every time I move my stethoscope.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, perfect. And now we're going to do whisper pectoriloquy. So again, whisper the word 99 every time I move my stethoscope. Okay, perfect. And while I have him back here, I'm going to be assessing for CVA tenderness. So down under the 12th intercostal space. Any tenderness there?
No.
Okay, now over here. Any tenderness there?
No.
Okay, perfect. I'm going to have you flip back around. And we're going to assess the anterior chest again. Looking for any obvious signs of deformities and symmetry. And then we're going to be doing equal chest expansion again. Take a big breath in and out. Okay, perfect. And now we're going to be doing tactile fremitus on the anterior lungs again. Oh, sorry, 99.
99, 99, 99, 99.
Okay, perfect. And now I'm going to be listening to the anterior lungs. Anterior lung fields. Okay, big breaths in and out. Okay, sounds great. And now we're going to be doing the cardiac portion of the assessment. So we're going to start by listening to all 5 cardiac points with both the bell and the diaphragm of my stethoscope. So we're going to begin with the aortic valve on the right second intercostal space, the pulmonic valve on the left second intercostal space, Erb's point on the left third intercostal space, tricuspid on the left fourth intercostal space, and mitral on the 5th left midclavicular line of the intercostal space. Okay, perfect. Now the other side. Got aortic, pulmonic, Erb's, tricuspid, and mitral. Okay, and now we're going to identify the point of maximal impulse. Perfect. And now we're going to listen at the apical pulse for a full minute to assess rate and rhythm. And the rate is about 60 beats per minute, and the rhythm is regular. And now I'm going to have you lay down at 45 degrees here. Please slide up a little. With the patient at 45 degrees, we're going to be assessing for jugular vein distension in the neck. We're also going to be assessing the chest for any heaves or lifts. And then I'm going to be feeling for any thrills at all 5 cardiac points. Aortic, pulmonic, Erb's, tricuspid, and mitral. And now we're going to be listening again to all 5 cardiac points. Okay, so aortic, pulmonic, Erb's, tricuspid, and mitral. And again, aortic, pulmonic, Erb's, tricuspid, and mitral. Okay, now I'm going to lay the patient flat. And we're going to be assessing the abdomen for any contours and symmetry. And then we're going to be listening to the major arteries in the abdomen for any bruise. going to begin with the aorta. And the renal arteries. And the iliac arteries. And then the femoral arteries. Okay, and now I'm going to be assessing all 4 quadrants of the abdomen for any vowel sounds. Okay, perfect. And now we're going to be percussing all 4 quadrants for tympany, dullness, or flatness. Okay, perfect. And now we're going to palpate all 4 quadrants for any masses or tenderness. Any masses or any tenderness with that?
No.
Okay, good. And now we're going to be assessing for, or palpating for the liver and the spleen. So I'm going to have you take a big breath in. And hold it. Okay, good. And now I'm going to have you sit back up. And we're going to move on to the musculoskeletal portion of the assessment. So we're going to begin by assessing the skin again, the upper and lower extremities. We're going to be looking at the color, the texture, the temperature, the turgor of the skin, the moisture, feeling for any, or looking for any edema, any lesions, scars, bruising, nevi. And then we're going to assess the upper extremity joints. We're going to be assessing the fingers, the wrists, the elbows, and the shoulders. We're assessing for symmetry. We're looking for any redness, swelling, tenderness, crepitus, or deformities, or any nodules. And now I'm going to check the capillary refills. Perfect. And we're going to fill the radial pulses nice and strong, +3. Okay, good. +5 grip. I think that's just a reflex. And now we're going to do range of motion in the fingers, okay? So just follow me. We're going to abduct, adduct, flexion, extension, and hyperextension. And then you're going to do thumb opposition. Perfect. Now the wrist, you're going to flex, extend, and hyperextend. And then you're going to ulnar deviate and radial deviate. And then you're going to rotate your wrist. Perfect. And now we're going to do your your elbows. So you're going to flex them in, extend, and hyperextend if you can. Okay, good. Now pull them up for me and we're going to assess the strength. Pull me towards you and push me away. Okay, good. 10 out of 10 strength there with the biceps. And now the shoulders, you're going to flex forward, extend down, and hyperextend backwards. Good. And then we're going to do internal and external rotation. So, yep, perfect. Touch your fingers behind your back and then the other way. Okay, good. And now we're going to abduct. And then you're going to rotate your arms. Good. And while I have you here, I'm going to have you push up against my hands and push down. Okay, 5 out of 5 strength there. And then we're going to have you adduct down. Perfect. And then we're going to be checking cranial nerve number 11, spinal accessory. Can you shrug your shoulders for me? Okay, nice and strong there. And then we're going to move on to the lower extremity joints. So we're going to be assessing the toes, the ankles, the knees, and the hips. Again, looking for symmetry, redness, swelling, tenderness, crepitus, nodules, or deformities. So starting with range of motion in your toes, I'm going to have you abduct, adduct, flex, extend, and hyperextend. Okay, good. And then your ankles, you're going to plantar flex down, dorsiflex up, invert, and evert. Perfect. And then rotate. Okay, good. And then we're going to check capillary refills down here. Good. And then dorsal pedis pulses and posttibial pulses. Okay, good. And now we're going to have you push down on my hands and pull. Okay. So 5 out of 5 strength in the ankles there. And now your knees push out against me and pull in. Okay, good. And now your hip strength, and then push in. Okay, good. 5 out of 5 strength in the knees and the hips. And then we're going to do the major, or the deep tendon reflexes. So we're going to start with the brachioradialis and the biceps and the triceps, and then let it hang loose. Okay, and then the patellar, and then the Achilles, and then the Babinski reflex. Okay, perfect. And then we're gonna be doing the vibratory sensation. We're gonna start with the medial malleolus. Can you feel that up your leg? What about on this side? Okay, perfect. And then we're gonna do the ulnar prominence. What about this side?
Yep.
Okay, perfect. And then we're gonna do light touch. So close your eyes and let me know where I'm touching you.
Right arm, left arm, right leg, left leg.
Okay, perfect. And then we're gonna do sterognosis and graphesthesia. So I'm gonna have you close your eyes and let me know what I'm touching, what I'm writing in your palm, okay?
A,
Yep. What about over here?
A,
No.
G,
Okay. And now let me know what I put in your palm.
coin, paperclip,
Okay, perfect. And now we're gonna have you stand up and we're gonna finish the range of motion in your lower joints. So follow me, we're gonna be assessing the range of motion in the hips. So you're gonna flex, extend, and hyperextend back. And then we're gonna abduct, and then you're gonna rotate, and then you're gonna adduct them together, and then we're gonna do inversion and exversion. So like a hacky sack, both ways. Okay, good. And now the other side, you're gonna flex, extend, hyperextend, and then you're gonna abduct, circumduct, and then adduct. And then again, you're gonna internal rotate and external rotate. Okay, good. And now with your knees, you're gonna flex them back, and then extend and hyperextend. And then with the left side, flex, extend, hyperextend. Okay, good. And now we're going to do turn around. We're gonna have you flex forward, just bend over all the way. And we're gonna be assessing for the normal curvature of the spine and feeling for any tenderness or any signs of scoliosis. So come, flex or extend back up nice and slow. Okay, good. And hyperextend backwards towards me if you can. Okay, good. And now we're going to laterally flex. So flex to your right and now to the left. Good, and now we're gonna rotate, so keep your hips in place. Yep, to the right and now to the left. Perfect. And same with your neck. I'm gonna have you flex forward, look down, and then slowly extend back up and hyperextend back if you can. Okay, and then we're going to lateral flex, so turn to your right, okay, and then to your left. And then you're gonna rotate your neck in the circles. Okay, perfect. And now I'm gonna have you walk forward normally. And then you're gonna walk backwards, heel toe, heel toe. Okay, perfect. And now you're gonna hop on one foot. Okay, good. And now you're gonna put your arms out like a T and close your eyes. Okay, no swing there. And then we're gonna sit you down for one last test. We're gonna do the cerebellar coordination. So I'm gonna have you touch your finger to your thumb as fast as you can. Okay, perfect. And now on your hands, you're gonna flip them back and forth as fast as you can. Okay, good. And now I'm gonna have you touch your nose to my finger. Okay, perfect. And And that concludes my head to toe assessment for spring 2025. Thank you.